Hello, my name is Maya, and today I will be talking about an important public health challenge that is relevant to those of us who work in the healthcare industry. I hope with greater insight it can help you educate parents or those soon to be parents. This topic is sudden infant death syndrome, or SIDS for short. So what is SIDS? The CDC defines SIDS, or it is also known, SUID, as the sudden and unexpected death of a baby less than 1 year old in which the cause was not obvious before investigation. These deaths often happen during sleep or in the baby's sleep area. As terrible as that sounds, it happens more often than you might think. It is the leading cause of death in infants between 1 month and 1 year of age, and the third leading cause of death of infants less than a year old. According to the CDC, approximately 3,500 infants die each year from SIDS, which equates to almost 10 infants a day. As you can imagine, it is devastating for parents. Bereaved parents who have lost an infant to SIDS experience a significant increase in mortality, physical health problems, and mental health difficulties. For mothers, there is a nearly threefold increase at risk of death by unnatural causes in 3 months following a SIDS death. So what causes this to happen? What is the etiology of SIDS? The truth is, we don't exactly know what causes every SIDS death. Sometimes, even through a thorough investigation, a cause is not able to be determined. What we do know is that increasing evidence suggests that some infants who die from SIDS have some kind of congenital abnormality or defect. However, researchers do not believe that these alone can cause an infant to die from SIDS, and that external environmental factors also come into play, including lying the infant prone to sleep, the infant overheating during sleep, infants acquiring an unknown infection, and exposure to chemicals like cigarette smoke. The discovery of prone sleeping being a cause inspired the Back to Sleep campaign, now known as the Safe to Sleep campaign, to teach and encourage parents to place their infants supine to sleep for every sleep. The CDC tracks data that points to a specific cause of an unexpected infant death. As you can see on the left, in a majority of these cases, this is determined to be SIDS, 37% of cases, followed by 34.7% of cases where a cause cannot be determined after investigation, and 28.3% of cases revealing the cause to be accidental asphyxiation or suffocation. The graph on the right represents the trends by cause between 1990 and 2019. As we discovered the ways that we can prevent SIDS and we introduced campaigns to spread this information, the rate of SIDS dropped, while the rate of unknown cause and suffocation and asphyxiation has slightly increased. The drop in SIDS cases can likely be attributed to the Back to Sleep campaign. The slight increase in unknown cause tells us that we still have a lot of work to do regarding the etiology of these sudden unexpected infant deaths. So what does SIDS cost? A cost analysis study estimated that over $10.5 million is spent on SIDS each year, with likely much of that including the cost of investigations. I'll now discuss the affected and at-risk populations, including who is affected most by SIDS, where it most often occurs in the U.S., and when it occurs. First, the who. Sadly, we have determined that there is a racial disparity in SIDS cases, with Native Americans and Alaska Natives being most affected, followed by non-Hispanic African Americans, non-Hispanic whites, Hispanics, and then least affected being Asian Americans and Pacific Islanders. A study that analyzed the birth and death certificates of infants of Native American mothers versus white American mothers showed that Native infants were 3 times more likely to die from SIDS than white infants. However, this elevated risk diminished after adjustment for differences in mother's age, marital status, parity, and smoking status during pregnancy. This points to more environmental factors coming to play than genetic factors, many of which are related to socioeconomic status. So how is the rate of SIDS related to a population's socioeconomic status? Well, after the Back to Sleep campaign, fewer infants have died to sleeping in the prone position, from 89% of cases to 24%, leading to the discovery of other risk factors. A 2006 study found that SIDS deaths occurred highest among families of low socioeconomic status, accounting for 74% of cases, with infant deaths of single mothers accounting for 40% of cases. And now on to the where. Due to the diligent tracking of SIDS cases, we are able to determine which states suffer the highest rates of SIDS. So from 2015 to 2019, Mississippi, Alabama, Arkansas, Louisiana, and South Dakota had the highest rates. In fact, the rate in Mississippi, 184.7 deaths per 100,000 live births, was almost 4 times the rate in Vermont, which had 46.3 deaths per 100,000 live births. As for the when, researchers used to say that SIDS most often occurred during the colder months, which would make sense with overheating being one of the causes of SIDS deaths. It makes sense that during colder months, parents might be more inclined to overbundle their babies to keep them warm. But researchers have now determined another factor to be more indicative of SIDS death occurring, and that is age. More than 90% of SIDS deaths occur before the age of 6 months, with most of these occurring between 1 month and 4 months of age. While SIDS is less common after 8 months of age, we should still encourage parents to reduce the risk of SIDS until the baby's first birthday. So let's talk about the major risk factors for SIDS and how we can prevent it with protective factors. As I mentioned, heat is one, with many infants dying from overheating while sleeping. Low income seems to be a significant factor, as well as infants being less than 6 months. Prone sleeping is one we know has led to a lot of SIDS deaths, as well as bed sharing and exposure to cigarette smoke. Congenital defects is another that is still being investigated and researched. Protective factors that are important to mention include placing an infant supine to sleep, considering the use of a pacifier, which we aren't exactly sure why it helps, but seems to reduce SIDS deaths, even if the pacifier falls out. However, I want to note that we should tell parents to never force their baby to use a pacifier if they do not want it. Breastfeeding is a huge protective factor because it provides infants with those important antibodies from mom. Room sharing but not bed sharing is important. Having an infant sleep in the same room with mom or dad, but not in the same bed, reduces the risk of SIDS. Immunizations for both mom and baby, as well as prenatal care for mom while she's pregnant. Placing the infant on a firm sleep surface prevents suffocation, and we want to encourage parents to not have any soft toys, blankets, or bumpers inside the crib as well. And supervised awake tummy time is incredibly important, because this helps the infant develop their neck muscles, which is important for preventing suffocation as well. It is also important to note that we should teach parents that when their baby is able to turn from back to front, they should stop swaddling their baby when they sleep, because this can lead to them turning over and not being able to turn back while their arms are restrained. So what are some public health nursing interventions that can be used to address SIDS? First, an important intervention is health teaching. We have seen from the success of the Back to Sleep campaign that educating parents is incredibly effective in reducing the rates of SIDS deaths. So what might this look like? Well, some examples include individual-focused interventions such as brochures and pregnancy classes on how to prevent SIDS, community-focused interventions like the Safe to Sleep campaign, but maybe one focusing on other preventative factors such as supervised tummy time, and systems-focused efforts such as what I'm doing now, educating healthcare personnel on how to educate patients and parents on how to prevent SIDS. Another intervention to consider is collaboration. This is an important intervention because it involves the resources of various systems, industries, and agencies put towards an issue that needs it. So, for example, collaboration between the government using resources to investigate the cause of SIDS deaths, non-profit organizations that can do outreach and raise awareness of this issue, as well as healthcare researchers receiving state and federal grants to study these causes can make a big difference. This also leads back to the government passing legislation that aims to prevent SIDS, such as laws passed in California that makes it illegal for parents to smoke cigarettes while driving in the car with children and infants. And lastly, disease and health event investigation. Because investigation is such an important part of discovering the causes of SIDS and how to prevent it, the CDC has developed a way for states and agencies to report SIDS cases. The Sudden Unexpected Infant Death Investigative Reporting Form collects information important for determining etiological factors, such as the infant's demographics, pregnancy history, like did the mother receive prenatal care or smoke or drink during pregnancy, infant history, did the infant suffer from any congenital abnormalities or defects, incident scene investigation, did the infant's crib have soft materials that may have caused the infant to suffocate unintentionally, and other important aspects of the circumstances in which the infant died. So what can you as a healthcare provider do right now? How can you help to prevent this devastating event in a family's life? The biggest things are education and investigation. We need to be educating our expecting patients, parents at their baby's first pediatric appointment, or before they even take their baby home from the hospital after birth. Also, patients of childbearing age who are considering having children, or older kids who have young babies in the home or might babysit. There are so many people that if they had the knowledge of how to prevent this from happening could make a difference. Also, you should stay up to date with current research that investigates the causes of SIDS. These are all ways that we can get rid of SIDS. Thank you for watching.